Welcome. My name is Angela Hodge, and today we are discussing awareness of socioeconomic contextual factors in EHR adoption. Could careful planning and awareness of socioeconomic factors improve the chances of successful adoption for a healthcare system? For this presentation, we will review the background, problem statement, findings in our literature review, a solution, and possible implementation options. Electronic health record implementations have become the norm in healthcare in the last 20 years due to the influx of regulatory requirements at both the international and local levels. But the industry has seen many issues identified by the studies in this presentation. Successful adoption has been a challenge, and multiple contextual factors have been called out as contributing factors to the failures of adoption. Those contextual factors include social and cultural items, economic and financial, regulatory and government, and technical factors. When reviewing the contextual factors in this issue, could careful planning and awareness of the socioeconomic factors improve the chances of successful EHR adoption for a healthcare system? Could it be that the socioeconomic issues are the main contributor, or is culture perhaps the main contributor to successful adoption? Let's review our significant contextual factors that have been identified for successful adoption. All of these are key components and equally balanced at this time as contributing factors. You do have cultural and social areas, which includes user engagement and disengagement, poor communication from management. Communication was seen as a standard response across the group. Lack of coping skills with change, again, another part of change management processes. If you move to the left, lower left, you can see regulatory issues. And whenever you have regulatory issues that are mandated from the top down by government requirements, very often industries do not respond well to those. They do not feel like they are adopting because they are engaged simply as they're being directed. As well, they may suffer penalties for not moving forward. And again, a lack of engagement will present itself in those types of situations. In the top right-hand corner, you see financial and economic factors that may come into play. Implementation planning is normally can be designed around financial reasons and not adoption. A fear of loss of productivity and failed AR recovery due to a shortened implementation is often very discouraging for users. They feel as if the revenue is more important than their adoption of the system, and very often they struggle with recovery due to the influence of the schedule that's put in place that often does not accommodate the needs of the user, but it accommodates the needs of the financial aspects of the system as a whole. In the lower right-hand corner, we see our technical aspects and the technical contextual factor and custom configuration and involvement in system changes. It's very important in electronic health records that the end user be involved in the system design at every level, from nursing to providers to finance to upper management. Lack of engagement in the system design often results in poor adoption in those areas. The findings in literature review revealed that while all contextual factors were contributors to poor adoption, there was resounding evidence in the interviews and observations to specifically call out cultural and social issues repeatedly across all studies. The 5 areas below have listed bullets in each area of those research documents to outline important points that may bring us back to the point to understand how important the cultural and social aspect of these contextual factors really is. If you look at 2011, the lack of an effective approach automatically is brought to our attention. And we see here it's stated twice, failure to communicate changes from the very beginning. And in interviews, it was actually stated that the managers, clinicians, and staff were skeptical of all levels of management due to the lack of communication. Communication is called out very early in this particular research document. In 2012, they identified coping with the many changes as very challenging. From the national level to the local level, in their interviews, they heard the same complaints of disengagement and inability to cope with the massive changes. Appropriate time was not allowed for the users to cope and adapt to the number of changes. This again highlights the complexity of the implementation and the necessary coping that is required by the individuals to be in place to adopt such a large change in their daily life. 2015, we are again hearing some of the same language. Users should have an initial role, and communication should include users for awareness. They very clearly noted without user engagement, there's a failure to foster ownership, and the organizational strategy should have required that they had a defined change management plan in place, the ability to socialize that message, the ability to share it with the organization and prepare them for such a large implementation project requires a lot of change management education and communication prior to the beginning of the project to prepare your users. In 2015, they actually compared the difficulty of adapting to a new electronic health record to the trauma of the grieving process. This analysis really highlighted the need to socialize the electronic health record in advance to avoid trauma to the employees and the providers. Again, socializing that message, communicating it ahead of time, making sure that they were prepared for the changes that not only impacted their clinical documentation, but actually impacted their daily operations from the morning they step in the door to the evening when they leave to go home. That impact is incredibly strenuous for an employee, and it's noted here in this study. As recent as 2020, our last research document, they identified that there was a failure to standardize the data collection and the feedback on the EHRs. But they did notice that regardless of the lack of standards, it did identify the need for user engagement and the appropriate environment and the right attitude to move forward with such a large scale implementation as electronic health records. For your reference, our literature resources are listed below. To conclude, after reviewing the literature available, it becomes clear from the repeated interviews, observations, and the qualitative studies that cultural and social changes are critical to adoption and long-term success of electronic health records. Even with the lack of standardized data collection regarding implementation, the feedback was clear. Users were disengaged, not coping well, and uninformed. For our solution proposal and conclusion, after we review the literature, it becomes clear that organizations who are seeking successful adoption should embrace the need for change management and culture changes. A socialization of implementation in advance and ongoing change management are important in managing the contextual factors in user adoption. In these 3 steps listed below, you can clearly see the need for communication and change management, whether it is beginning the discussions for electronic health records and preparing your staff for change management and moving through the process of change management. You can't communicate enough throughout this process to make it successful. If you plan early, you communicate often, and you are transparent at all levels, you build the employee and the provider trust in the engagement of the project. And keeping them involved at all levels of the project is very important. And finally, it really should become a perpetual cycle. Plan, engage, repeat. Ongoing communication and engagement is necessary to maintain the culture, just as it's important to maintain the electronic health record systems. Building and supporting the culture and building one of acceptance goes across many spectrums, including technology. And this will help to drive acceptance in other projects as well. Thank you for your time today.